here today to talk to everyone about some of the things that we've been working on recently around the health and care workforce and around influencing local health systems.
I think firstly to connect with others working in the same space.
To understand our place in that sort of system and how we can be better at what we do and contribute even more.
We see the Active Partnerships Network as a really important relationship, and we know that if we want to make a difference on integrating health and physical activity, we need to be working at the national level and the local level. So I'm here today to try and see if there's different ways that we can collaborate and how we can work together so that we have that rounded influence.
It's hard, complex work, so meeting others, understanding what others are working on. And I think sharing learning and best practice, so where things are going well in other areas, perhaps areas of the system in healthcare that we've not yet thought about.
In GM Active, we've been working for some time on what's become known as the pivot to active wellbeing, which has sort of been picked up by Uniting the Movement and Sport England to help support the improvements to population health and addressing inequalities.
I think even in the last 12 months we've seen a real shift both at the national level and at the local level in how willing systems are to recognise physical activity, not just as something for prevention, but to recognise its role in treatment and in self-management of long-term health conditions.
And I think part of it is kind of how we work, our approach to working together and partnership working. And I think you can gain a lot of that from talking to others who are trying to do something similar in their place. It's people dynamics, isn't it? So it's really important to kind of understand where you're facing blockers, how you might be able to take learning from others to kind of overcome that.
I think it's the same as a lot of these events now. It's making sure that we stay in touch with people to create new connections. I'm really excited about the Active Partnerships being here today en masse.
I think it can often be quite siloed, and I think we need to get out of that way of thinking over the next few years and really recognise it as just one of the fundamentals of living well and keeping healthy for longer.